So I had this patient, right? And this particular patient was having some pain, lots of pain, and it happened to be in the testicular area, which is bad. That pain was originally, we know, caused by a sport we call hockey. And if you didn't know this about hockey, it's a terrible and evil sport, though a lot of fun, that when the ref's not looking, you can do horrible things to your friends with those sticks. Bad idea, but that's where we are in life. In any case, we had this problem, and it was a bigger problem, so it was surgically fixed. So medically, it's fine. Great, cool. But guess what? The pain persisted. The pain did not go away entirely after the surgery. So we need to look for something else. We found that the T11 to L1 area was in quite a state. And to explain, let's just switch to a side view. So that T11 to L1 area, more specifically around T12, was flexed forward. It was forward bent. At the same time, if we throw in a vertical axis here, it was rotated to the right, and it was also side bent to the right in a bad way, a not good way, a rigid, very much stuck way. So we throw up another layer just for illustration purposes and put in a square to represent that vertebrae. It would look something like this. So the vertebrae would be bent to the right, and then the parts of the vertebrae that we would see more clearly, spinous process be over here. We'd see a little bit of that TVP, and then we even see a lot more of the other transverse process. So it is stuck in this flexed, side bent right, rotated right position in that T11 to L1 area. Now, what's interesting about that particular area is that a nerve that bridges this space comes from this area. So the ilioinguinal nerve. Now that's mostly the T12L1 nerve, but T11 is certainly involved because it's close enough. And some of the innervation to the organs, to the blood supply, comes from there as well. Very interesting. So we've got an old injury. We've got an area that sends nerves to it. But how is that pain actually being sustained? There's a few things in the region that could certainly do that. So consider what's in between these structures. There's always going to be ligaments, and strain of a ligament could certainly cause irritation of a nerve. There's a disc in here as well, and that disc, well, usually causes lots of problems at times, but maybe not. We could also have direct nerve impingement, which always causes extreme nerve pain, and often down the distribution of the nerve. The body gets confused, thinks it's coming from somewhere it's not. These are possibilities. Now, what is exactly causing it? It's not up to us. That's a doctor with an MRI. Hopefully they can figure out. We need to figure out how to correct this position. What you have to understand about the muscles of the spine, they are in fact involuntary, and they are numerous, very numerous. So there's ones that go between the spinous processes, there's ones that go between the transverse process, not quite pictured here, and then we have multifidi and rotatories that go in basically every other direction, crisscrossing like so up multiple pathways, multiple vertebrae in fact, and they integrate and link the spine, but they are completely involuntary, and so that means they react to changing positions. You can't choose where they go where they are needed to, and they react. So if I want to really stick a vertebrae in a side bend position, I've got to get the muscles that pull it in this direction to pull hard. Now, if I want to get it rotated in this direction, I'd probably want some of the muscles that pull it this way and maybe this way to pull on it quite hard. And I have no control over that. The patient has no control over this. The body just does this at time, in time, with time. So we have to question, is this a reflex of the original injury? The body reacting to the problem now that's gone away, but still the effects remain. What you have to understand is that this points to a bigger fundamental problem and solution in the body, because the body, the musculoskeletal system, is a reflection of what's going on deeper internally. in the web and network of the nervous system. So in this case, even if it started low, it can be sustained from somewhere up higher.